Hihingi sana po ako ng tips paano po ma-survive internship po sa PGH. So, hi Doc, let's answer your question in this video. Hi, my name is Lloyd and I am a general practitioner and moonlighting doctor here in Misamis Oriental. And I recently took my board exam last year and I finished 1 year of internship at the Philippine General Hospital. So to that incoming postgraduate intern who recently got matched in PGH, well, congratulations. I'm sure it's a big decision for you to weigh your pros and cons. I'm sure it's a big achievement already on its own to be matched in PGH and a big privilege to be given a chance to go on duty in the Philippine General Hospital. And at first, I wanted to reply to you sa message, pero I thought na, what if let's make a video out of this na lang. So hence this video right now. And so right now, habang wala pang masyadong pasyente right now sa duty, let's answer your question. So in this video, I'm gonna share some tips. There's timestamps down below if you just want to skip to a certain part. So let's start with the first one. Number 1, know your why. So you have to know very well why you chose PGH. Because there's many reasons, there's many valid reasons. Like, is it for the learnings? Is it for the experience that you'll get from the many patients that you'll see? Or is it to have better options during residency later on? Or is it to help you prepare for your review for your board exam next year? So there's many reasons. And what's important is dapat klaro sa'yo before you enter PGH what your intentions are. Kasi once you get in, as soon as your first rotation, as soon as even your first day of duty, for me, during my first day pa lang sa intern, it was very hard. And sobrang na-culture shock ako to the sudden change from clerkship. And if I had my clerkship in PGH, how much more for someone who has a totally different hospital experience, especially the first few weeks, from the big patient loads to all the tasks expected from you per shift na minsan nga di mo matatapos lahat, and to all the requirements, mga exams, mga oral exams, mga quizzes, and yung mga nitty-gritty system ng PGH, like all the forms you have to fill up and all the tasks beyond job description ng doctor or as an intern. Like kahit mag-bring ng patients to the from the emergency or ward to the X-ray room, even those tasks are expected from us as interns in PGH. And the frank reality is actually, after just the first few weeks, madaming nag-quit. Like, madaming what's the term? Like, reassign to other hospitals. But, if you know your why, hopefully, this would help you decide better if PGH is worth sticking out the next few months or the next year. If you have a clear reason before you're coming in, knowing your intentions, why. Tip number 2 is to grab every learning opportunity. So if your intention, why you wanna be in PGH, is to learn or to see as many cases as you can, my tip is to grab every learning opportunity that you can. And these learning opportunities, they come in many forms, like from the patients that you see, to the many procedures that you do, or sa mga patients, and even sa residents sa ward na nag-rounds, and you happen to just pass by, and then you see a fellow, for example, doing something interesting, like nag-aspirate siya ng synovial fluid from the knee of a patient. And there, that's already a learning opportunity. And minsan yung mga ibang fellows na nag-ultrasound sila sa ward, you could just approach them. That's already a learning opportunity. And learning opportunities could come in yung mga optional lang na mga seminars or mga talks from the other departments. Learning opportunities could come even in mga research opportunities that could open up for you to write a paper while your internship. These learning opportunities in PGH, they're really a lot. whether you're through patients or to all these other opportunities, and they won't be confined to just reviewing for your quizzes or reviewing for your conference the next day. The most frequent people na you'll learn from day to day are your residents. So you should show your residents na you are willing to learn and like you want to learn. So to do this, you could maybe introduce yourself to them when you see them in your duties, and kahit hi lang. And if you see a procedure na you wanna do, you have to volunteer. You have to tell them na if they could teach you how to do that specific procedure. Kasi they won't give it that opportunity. They won't give it basta-basta lang to anyone. Like they won't kakatok sila sa call room ng mga interns, tapos tatanong sila na, okay, may for paracentesis dito, sinong may gusto, gano'n like. Usually they won't do that. Although may mga mababait na residents who do that, but mostly the first step to show interest is you. If you see a resident na friendly, like you could tell them, uy, sir or ma'am, kung may procedure, like, can I be the one to do it? Mga stuff like that. And whether it's paracentesis, or even the routine mga blood extractions or Foley catheter insertions during the first few weeks or first few months, it's gonna be very helpful. And kahit sa OB nga, yung pag-internal examination ng mga pregnant patients, I didn't realize na they're gonna be so helpful right now. Like, during nagmo-moonlight now, like, I didn't expect na sa emergency room right now, like, lahat ng papasok na pregnant patients, yung emergency room admitting physician pala, yung mag-aayi ng lahat ng patients. So, sobrang helpful to all that internal examinations opportunities I had during my OB rotation. Okay, that's medyo weird na example, but I hope it kind of makes sense. Next tip is to have good relationships with everyone. You need to have good working relationships with everyone, from mga nurses, mga utility workers, residents, consultants, and especially your blockmates. Kasi they're the people who you would see every day for a year. And some, not just blockmates, pero especially yung mga duty mates na din. Like, some would be very helpful in terms of workload. And may mga iba din na you have to exert extra effort to survive your duty. Residents, be nice to everyone, especially your seniors. Kasi you'll spend the most time learning from them. And it would be residents who would give you the most learning opportunities, whether it's mga procedures like sa surgery, like suturing sa ER, or yung mga procedures, other procedures sa internal medicine. And kapag may mga requirements like mga quizzes, mga exams, mga oral exams, you're gonna get a lot of helpful tips from your residents. Now, the next tip is kind of specific for those who are interested in surgery or mahilig sa mga OR experiences. So if you're someone who's considering surgery, my tip for you is that, okay, one advice is like there's really gonna be a lot of operations every day during your surgical rotation. And most cases would be, like the routine cholecystectomy, modified radical mastectomies, mga ganun. But then, sometimes, there's gonna be occasional, like, very interesting, unique cases. Like, mga open heart surgeries, or sa ortho rotation, like, mga scoliosis correction procedures, And there's really gonna be a lot of operations. But, the catch is, di palaging ikaw yung ma-detect to those cases. So, what do you do if may case na like interesting and you wanna assist or observe pero like off ka or something? Well, one suggestion is, for me, like what I did was sometimes if there's a procedure na like I really wanna observe, kahit di ako assigned, like I would go to the operation that morning and I'd wait for the consultant to arrive, and I'd ask permission kung pwede bang kahit observe lang. And usually they would allow me to observe. And with what I did with that's how I got to see mga interesting cases kahit hindi ako yung nakadeck. like mga open heart surgeries, yung mga valve replacement sa mga congenital heart diseases ng mga babies, and mga cabbage procedures. Yeah, that's how I got to observe those school cases. If one of your goal for internship in picking a hospital is to have a lot of time to self-review for the board exam, well, internship in PGH isn't the best idea. Kasi you'd spend so much time on duties, and kapag off-duty ka na, parang mas tempting to just rest or go out kaysa mag-review. Kasi sobrang nakakapagod ng feeling after duties. So, there won't be much time to review during internship. And there might be more time to review if you had your internship in another hospital. But, I tell you, during my board exam, a lot of questions, medyo nasasagutan ko. Not because I remember seeing them in the reviewers during board review, pero I remember seeing, similar cases during my rotation. So, especially sa OB, sa surgery, yung mga clinical na subjects. And kahit sa anatomy, may mga medyo surgical questions din kasi medyo na-figure out ko sa choices yung sagot. Like, naka-cross out ko na yung mga mali. Because of the cases that I remember during my duties. So, my suggestion for you is kapag you see mga cases during your duties, study as much as you can on those cases, read up on them. Yung bare minimum na basahin mo is kahit yung summary tables lang sa up-to-date or sa stock pearls online, kahit one paragraph lang basahin mo. Or kung may books kayo, like mga platinum books, kahit just quick skim over lang. Like, I tell you, like, they're very, very helpful to just make those cases stick inside your brain. And if they don't stick very well, like glue, kahit konting familiar lang, ganun. Like, that's gonna be very helpful during your board exam. So, this one's my final tip for you. And this tip is something that I am very passionate about to share, especially with med students. And it's to have a good note-taking system. Kasi, you'll use the notes that you have during med school when you moonlight afterwards. Kasi, you know what, you won't remember all the doses right now during internship or all the best practices that you do right now during your duties. But, if you write them down or if you type them down, and if you find a way to preserve all the notes that you have later on, these notes that you have right now during your rotations would be very precious. So personally, how do I take my notes? Number one, I decided to stick with one specific note-taking app. And for me, I decided to stick with the default notes app ng Apple. And after trying so many apps during med school like Evernote, Notion, Google Keep, Microsoft OneNotes, kahit Microsoft Word, after trying all of those, what worked well during my internship is the default notes app ng Apple. Kasi it's the most flexible, it's the most versatile, it's the smoothest, it's the simplest note-taking app. And na-discover ko siya kasi, like, habang nag-rounds in IM, I noticed, like, but yung mga residents, like, why do they use Apple's yung notes app ng Apple? Like, it's so simple, it's so blank, but why do they use it? And when I tried to use it, dun ko na-realize na, sobrang basic lang niya, wala siyang masyadong colors, ganun. But, the search function is very, very precious. It's very powerful, yung search function ng notes app. When you take your notes, you have to write it in such a way na they're gonna be searchable later on. So, for example, nag-rounds kayo today, for example, may summary rounds today, don't label that note sa title as summary rounds January 1, 2001. No, you label it like something that you'd Google to yourself later on, like, okay, indications for vaginal delivery after cesarean. Ganun, like, that's what you write in the title and you list it down. Para someday, parang when you Google to yourself, you type in those keywords and then it would be your notes that would come up first. I keep a note for all of my readings na I feel like I'm gonna use these later on. Like yung mga, for example, when I read mga CPGs ng UTI, ng diarrhea, mga dengue, stuff like that. They're really, yung mga notes ko on those were very helpful right now. Na nag-moonlight now. So, that's one tip. That's a very good investment, is to have a good note-taking system. It's up to you to figure out what note-taking app works for you, whether you have an app or whether you'd use a notebook that you write on during your duties. What's important is you develop a good note-taking system that's easy to not just write, but it should be easy to look up to later on, 5 years from now. And okay, that's all my tips for now. And let me just share, for me, like how I felt after my internship. Immediately after my internship in PGH, I really felt very tired and exhausted. And na-feel ko talaga na parang tumanda ako after a year. But if I ask myself, like, was it worth it? Like, lahat ng pagod from mga duties, and after all the doubts that I had, like, habang nag-duty na parang, worth it pa ba to? Like, is this worth sticking out for 1 year? Or like questions like, wait lang, sobrang nakapagod na to as an intern. So like, how much more kapag naging resident na ako, like siguro times 10 ng pagod, like worth pa bang mag-residency later on? Like those doubts definitely came in. Even as early as just my first week in internship. But right now, after 1 year, thankfully, like na-survive naman. And I would say na like, it was really a nice experience and it was really very helpful to me right now na nagmo-moonlight ako. So to that doctor, incoming PGI in PGH, I'm sure na you do well. And sa dami ng sinabi ko, at least just start with the first step. And that's to ask yourself, what's your why? Why PGH?